Lee.
Dr. Chrix Xu is the chairman and CEO of a company called ThermoGenesis. We got to meet him a couple of weeks ago. They're a publicly traded company under the stock symbol THMO. Their future is immunotherapy. They're saving lives as well. And they're in the cell and gene therapy business, which has been a very expensive business, but a very, for patients anyway, but it's been a real breakthrough for healthcare with cell and gene therapy if you can bring it to market. By the way, you can go to their website, ThermoGenesis.com. But Chris, we had such a good response last time we had you on there. I want to give you a chance again to take us from the top down and tell us what you're doing, because it's pretty exciting stuff.
Yes, indeed, and especially in the last 5 years. As I said, I am an immunologist for the last 25, 30 years, and even for me in this field is eye-opening. Because never have we in history that we've been able to treat cancer patient on deathbed who has failed radiation and has failed chemotherapy, and we give them a shot, one shot, and 93% will respond. That has never happened in the history.
Wow. And it's coming from their own body, right? Isn't that the main thing here? Is that cell and gene therapy it's, I'm not going to suggest it's organic, but it's pretty interesting how it's coming from yourself.
Yes, indeed. Because guess what? You know, your body is the most complex machine, and your immune system were learned and educated to fight against all kind of invasion, such as virus, such as bacteria, such as mutations that causes cancer. So we've been trying to find, in the last almost 80 years, trying to find small molecules that treat disease. But see, we can treat only simple disease, such as pain, such as some, high blood cholesterol. But when we're dealing, what we have left behind are complex disease, such as cancer, which is very complex, such as aging, which is also very complex. So for those complex diseases, the best is to use your own complex system to fight against that. So the best in this case is the immune cell, your own immune cell.
So the question would be, Chris, is and I will get this again from folks emailing us, is how does it work exactly in layman's terms?
Yeah. So the layman terms that hopefully I can lay it down close enough. So your immune system were known to looking for cancer, looking for mutations in the body, and that's instantaneous. So that's why you, me, everybody here are healthy. We have mutation in our body, almost like 1,000-ish mutation every single day.
1,000 mutations a day inside our own bodies.
Yeah.
Wow.
Never occurs
I knew
us.
Costa was a mutant, but still. All right.
That's because your immune system kind of survey your body looking for those mutations that could cause cancer. And sometimes your immune system can get weak or kind of beguiled by the tumor. So in those cases, tumor came out and escaped the surveillance by the immune system. So this CAR T therapy, which is breakthrough in the last 5 years, is really taking those immune cells from the patient, kind of slap in the lab and wake them up and put them back into the same patient so that they will recognize the cancer after this treatment. It's all autologous in scientific terms. Autologous really means yourself.
Yeah.
You cannot, at this moment, you cannot use other cells.
It's almost like you're vaccinating yourself with your own stuff. You're giving yourself a vaccine.
You're boosting
based upon or boosting yourself.
Yeah,
interesting. By the way, Chrix Xu is his name. Dr. Chrix Xu, chairman and CEO of ThermoGenesis Holdings. They are publicly traded under the stock symbol THMO. You can go to ThermoGenesis.com. What's next for you guys with FDA? What's next for you guys with respect to your business model over the next 18 months?
Yeah. So we are trying to make this wonderful therapy accessible to everybody. Because currently, unfortunately, the cost of this therapy is way, way, way too expensive. I mean, $500,000 per dose for one shot. That's a hefty price tag. We want to make this low so that it's more accessible to everybody.
And what's the answer? Is the answer getting it closer to the hospital? Is the answer doing it in the hospital? Is the answer a different technology?
The answer is innovation, automation. And we want to make the manufacture process more efficient and lower cost. And that's one part of the equation. And the second part of the equation is we want to make the patient can always access this therapy when they need it. And that's a different ballgame because immune system, as you said, as you know, are very sensitive.
Chris, before we get into
Yeah.
before you answer the question about you guys as a company in the next 18 months and the actual FDA, what's insurance? Is insurance has insurance adopted this?
Gladly, insurance now pays for 80% of the therapy, but even so, the remaining 20%, if that's a copay, that's a big price tag. That's almost $100,000.
Wow, at 20% it's $100,000.
Yeah.
Wow, my goodness. That's
Yeah.
and what we're trying to do is drive those prices down.
Yeah, eventually, our mission, we define our mission is to ensure the future benefit of cell gene therapy to everybody in need.
Yeah. Right.
So that really means we need to hold this low so that everybody can afford.
Well, and I think the innovation thing cannot be understated. You guys remember when we had our grandparents bought us a calculator when we were little kids, and it was a $100 calculator, and basically it could do addition, subtraction, division. And now those calculators cost 35 cents at a mini mart on a keychain, right? That's all innovation is all that was.
Exactly.
It's the same technology, the same brains as the very beginning. Do you feel the same way that innovation is just going to get the prices lower, or get the costs lower, I should say, and the availability wider?
Exactly, that's what I think, because when plasma TV came out, that's $20,000 per plasma TV.
Yeah,
and now you can go
true.
to Best Buy for $2,000, right?
Wow.
So for this drug innovation, I think, number one, it's going to be a big wave. It's not going to be 3 years. It's going to be in the next 30 years, because basically we have over 6,000 rare disease that has absolutely no drug.
So, but the velocity for a single disease using single cell gene therapy, CGT, is that will they knock out one at a time and over the next 30 years we'll have them all? I mean, do they come in? Is there a velocity or is there a triage where one, it gets done faster than the next? How do you feel about that?
This opens the entire door for a whole class of diseases that in the past has no cure.
Yeah.
So cancer has all those different subtypes. And not only cancer, remember we have all the other diseases also treated by cell gene therapy, such as aging, premature aging, accelerated, those genetic
I think
diseases
most of
was
us
awful.
accelerate our own aging.
It looks
in
fine.
our 20s.
It looks fine.
Chris, what as a company, is the goal to keep marching on to the next 18 months? Are there milestones that you have in mind for you guys?
Yes. The first milestone is we want to change the business model. So, the company has been around for 35 years and always been a medical device company and been doing very good developing new technology. However, I believe the business model is problematic and not captured value. That's one. So shareholder doesn't benefit from that.
Right.
Also, it doesn't help the patient enough because we are not maximize the impact from the company. So for the next 18 months, we are really transforming this from a medical device to a service company, so-called, doing cell manufacturing for cell gene therapy and doing cell banking for the patient.
So cell banking would be almost having a genome library, but for the patient. The patient's banking. Now, do you have to do it as a kid, or can you do it as an adult?
Or for adults in this case, and it's almost like egg banking. Now it's more of a thing. It's more prevalent as compared to 20 years ago.
Yeah. And the best part of this thing is that we've got it's a vaccine almost, and it's coming from your own body. Let's think about that.
I almost think this is insurance, but instead of benefiting someone after you being dead, it's like benefiting yourself.
Love that stuff. Chrix Xu, thanks, pal. We'll see you again in the next week or so. Chrix Xu, Dr. Xu, as I like to call him, chairman and CEO of ThermoGenesis Holdings. THMO is their stock symbol.